everyone, I am Andrea Arce, and in this video, I will be demonstrating how to do a newborn physical assessment. I hope you guys learn and enjoy the video. Before we start, there are a few things you need to be aware of. First off, you want to make sure that you have a good lighting so you can adequately see your baby. Secondly, make sure that your infant is calm, so you might need a pacifier or have the mom nearby so she can hold and comfort the baby. Lastly, you want to work with the least invasive scale to the most invasive. This way, your baby will stay the calmest the longest amount of time. The very first part of the physical assessment of a newborn is to get their weight, their length, and the circumference of their head. And when you walk into the room, the other thing you're going to want to immediately look for is how the baby looks. So you want to check their color, make sure they don't look jaundiced, and that their tones look okay, not super fluffy, but at the same time, they're not super tight. And you would want to inspect their skin and see if there's any lesions, birthmarks, rashes, or anything that's going on. So these are all the things that you just want to note and reassure the parents on. But the basic idea here is to have a general overview of the infant. It is also very important to review the vital signs. In normal infant, the heart rate usually ranges between 90 to 160. The respiratory rate is usually high, between 30 to 60, but that's fine. Blood pressure is not usually measured unless the infant is critically ill, but if the infant is well, the blood pressure is not a critical measure. Remember that the pulse oximetry is abnormal in the first day of life and especially in the first 10 minutes of life, usually 60 to 90%. After the general overview of the infant, since this is a head-to-toe physical exam, I will be checking first her head, its structures. So I am looking at her hair. It is well and not typical of a newborn since we're using a doll. Now I'm going to go ahead and feel for her fontanelles. The anterior fontanelle is high here on top, shaped like a diamond, and it's the larger of the two fontanelles. And then the posterior fontanelle, it's on the back and sometimes harder to feel. You want your fontanelles to be soft and flat. So when you rub your hands across, it should feel flat and it shouldn't feel bulge or shouldn't feel like sunken. Then we'll look at her face, check for symmetry, notice that her eyes are symmetrical. Her eyes are closed at the moment, but we usually and absolutely should do a red reflex to check for abnormalities in the eyes. Also, the possibility of sleep lenses, which can cause a variety of infant diseases. And now it's time to check for the ears. So the ears should be flexible, but in this case they are not. Now, ear problems are said to be associated with kidney problems for some reasons. So aside from that, we have to check for the PEEPs, tags, and other malformations. So with her nose, since babies are nose breathers, we want to make sure that her nares are patent, and to do that, we'll just have to close one side with our finger and then the other side and check if she's still breathing. So now we move on to check for the abnormalities in the mouth. So when we look at the lips, make sure that there is no cyanosis or any bluish color that may indicate poor circulation. So they must be soft and moist. So check also if there is cleft palate. If there is any, please note. And check the palate inside. So sometimes they are highly arched or sometimes abnormal, so also note that. Now, while our finger is inside their mouth, check the baby's suck. So it should be vigorous. We would also want to inspect the gums. There might be some Epstein pearls present, which are normal, and we want to make sure that there's no teeth growing. So if you do see one, please take note of that and check if the tongue is good and moist. So another reflex that we can check here is the rooting reflex. That means when you try to strike the side of the mouth, she should turn towards the stimulus. Next, let's check the neck, and that trachea should appear at the midline. So for the next part of the assessment, I'm gonna unswaddle her and we'll check the body. We're gonna move down to the torso. So I'm just gonna uncover her a little bit to still keep her warm and comfortable. First thing, I want to feel for her clavicles. This is important to check for deformities or any decrease of range of motion, or if she's in pain while palpating them, which may indicate a clavicular fracture. I'm gonna take her arms to check for the range of motion, and I'm gonna give her my fingers to check for grasp reflex there. So we're gonna look at her fingers, make sure there are 5 in each hand, and then check the chest. So her nipples should be symmetrical, but in this case she has athelia or she has no nipples. And to check for the capillary refill, so usually in adults we check them on the fingers, but on a newborn we do it right over the sternum. So I'm gonna hold and press for about 5 seconds and let go, and should refill within 3 seconds. Next, I'm gonna check for her brachial pulses. So you want it to be equal on both sides. So I'm gonna listen to the long sound. So when you're counting for the respiratory rate, you count for a full minute, but for the purpose of this video, I'm not gonna do a full minute. Okay. For the apical pulse for a newborn, you're gonna have to go to the 4th intercostal space, just left of the sternum there. So you're gonna do this for a full minute as well. Next, I'm gonna listen to the bowel sounds. So while you're doing this, you can actually look at the abdomen shape. Newborns usually have a round appearance to their abdomen, so that's normal. But if it looks distended or tight, you might need to further evaluate it. And while we're here, we want to look at her breathing effort. Newborns are belly breathers, so they breathe in around their diaphragm, called diaphragmatic breathing. So you should see her belly moving while she's breathing, so that's normal. And if she's in distress, you might notice retractions, especially right here, substernally, or up here, suprasternally, or even intercostally within the rib cage. Now moving down to the liver, we should be able to palpate up to 3 centimeters below the costal margin. Spleen and kidneys may also be palpated. So now we check the navel. we can see that her umbilical cord has fallen off and the area around it is healing nicely. So if you're looking at the umbilical area, you want to see if there's redness or any unusual drainage. And then we're going to go ahead and check her Moro reflex. It's called the startle reflex. So what should happen when I lift her up a little bit and let go? You should see her arm flare up to the side and come back to her body. Okay, so we're going to move on down. So you want to try to check the genitalia for abnormalities, but for the purpose of this video, we're not going to. But just know that we have to check for the patent rectum. So don't forget to check that on the part of neuro exam because it can be a real critical surgical emergency in an infant. We're going to go ahead and move down to her legs. So we want to see that they're symmetrical, equal in length. Look at her feet. Check if she has 5 toes. And note that acrocyanosis is normal and common. So check for the range of motion. Next, we'll do the Barlow maneuver and the Ortolani maneuver. This could check for congenital hip dysplasia. So let's do Barlow maneuver first. And in positive test, you're gonna hear clunk, and that would mean that the hip is dislocated. So we're gonna do a femoral pulse right here in the groin. Again, pulses should be equal on both sides and strong. Then you can check the grasping reflex on the feet. Range of motion. You can also check the capillary refill on the area of the knee. The reason why we want to do it more centrally on newborns is to check for cyanosis, because central cyanosis can actually indicate cardiovascular issues. And we're down to the last part of our examination. So we're going to flip her over, check her shoulders, spine, if it's straight, sacral dimples or tufts. So we're going to try to do this fast on this part. So we'll check her bottom gluteal folds are equal. So we'll look for her lower back. What we're going to want to look for is any kind of bulge or tuft of hair or deep dimple, because all of those could actually indicate a neural tube defect. And when you're done with your exam, make sure that the diaper is nice and dry. Put them back in the position that they were in, and make sure that they're in good condition and comfortable before you leave the room.